You're listening to PetLifeRadio.com.
Well, hello and welcome to another episode of Ask the Vets with Dr. Jeff here on Pet Life Radio. I am sitting here in my office in Los Angeles, California, and we want to hear from you. I'm here for you. And, once again, the giveaway is when you call in and ask us a question here on Pet Life Radio, and I'm giving you the numbers and the ways to get a hold of me in just a minute, we will send you out a free ProSense pet product, of course, ProSense being our show sponsor. And we want you to have some great product that typically you would only find at your veterinarian. However, with ProSense, we're giving you that veterinary quality product that you can find at your mass retailers like your local Walmart or your Target or your Walgreens, because we want to give you the best that you can buy and make it very easy, convenient, and inexpensive for you to get. So to get a hold of us, you can reach me here at 877-385-8882. Once again, 877-385-8882. We want to hear from you. You can also send me a quick email to drjeff, Dr. Jeff, at PetLifeRadio.com, because we're Let's Talkin' Pets. We are talking pets here at Pet Life Radio. So anyway, it's, I'm sure you've heard the expression that bad things happen in threes. Well, unfortunately, yeah, this week was the case of that. If you recall, we talked about a week and a half, 2 weeks ago, about Lola. Lola was that Australian Shepherd that had that humongous splenic mass that, of course, turned out to be a splenic tumor, unfortunately. The dog is doing great. She's totally healed from her surgery. And unfortunately, it's kind of one of those things with a splenic tumor that came back, as we call hemangiosarcoma, that the heart of that is now removed. That was the bad spleen. But we're just waiting, even though right now the liver looked good and the intestines look good and the lungs look good. Unfortunately, we know that splenic hemangiosarcomas do spread, and it's just a matter of time. Unfortunately, I can't predict when. I always joke when people ask me, when or how this is going to happen and when should I prepare. And I tell them, well, the truth is my crystal ball is in the shop. So it's your guess is as good as mine. But usually these things will happen within a short of 2-3 months. And one of the longest I've ever had was 12 months after surgery, which was unbelievable. Since it was an old dog, it almost didn't affect her overall life. Well, anyway, as that Murphy's Law would have it, 2 more cases came in, not only this week, the same day, the exact same day. 2 splenic tumors, splenic masses, I should say. One, unfortunately, was a tumor and already had spread to the liver. The liver masses were not bleeding, so we completed the surgery. We removed the spleen. We sewed him up, and he is home with mom and dad right now. And as I told them, enjoy every minute of every day, because once these splenic lesions start to open up, they start to rupture, and they start to bleed, there's not a lot that can be done. So that's my buddy Buckley, and Buckley is just a great, magnificent American Bulldog. Those of you who don't know, American Bulldogs are the big ones. People mistake them for Mastiffs sometimes, they almost look like a Pit Bull Mastiff boxer type cross. Very, very large dogs, big heads, but sweet as can be. The Bulldog personality. So you got the Frenchies, which are the little guys. Then you got the English, which are pretty big themselves. I've had some English bulls that are, pushing the scales at over 70 pounds. And then you got the American bulls, which easily can tip the scales at over 100. And then, same day, a Queensland Red Heeler, it's the official name is an Australian cattle dog, comes in the office, evidence of a little bloated belly. We put the ultrasound probe on. We pull some blood, take an x-ray, see the ultrasound. Sure enough, splenic mass, same surgery. But this one was interesting. This one was in worse shape going into surgery. But the mass itself was literally, the spleen was disintegrating in our hands as we were moving it. So there was much more blood and discharge through the procedure. The dog was sicker going into than Buckley was. But I think the prognosis of this one's going to be better, because when we see that, we often get a diagnosis of a splenic hematoma or a splenic hemangioma. And both of those are benign problems, meaning now that we took the spleen out, and if it does come back, either hemangioma or hematoma, she is cured, 100% cured. And that is fantastic. So, anyway, earlier on in the show, when we were just kind of setting up, this is great, by the way, because this means that people are listening. You are listening. You are getting up the courage to ask questions. And we got a call from Nelson. I'm just going to prep you because we picked up the call in the middle. In fact, I think we can have you listen to some of this call. But Nelson called about his puppy female pit bull, 4 months old, and already chewing and biting, and of course adopting a new pit bull. And we're so thrilled that Nelson went out and adopted a pit bull. He was concerned, and of course I don't blame him. And I think with social media and the media in general, you start talking pit bull and everybody's like, oh my god, this poor dog, he's take him to the shelter and put him to sleep. And I said right away, I said, if this were almost any other breed at 4 months old exhibiting these same signs, he would not think twice. But unfortunately, because of the bad press that pit bulls get, he is so concerned. So we talked about the biting problem, the chewing problem, and I think I've mentioned this before, that biting is a normal, natural, essential puppy behavior. Puppies play all the time. They play bite all the time. They learn some bite inhibition. They learn how hard they have to. So anyway, you know what? Why don't we kind of have you listen in on the call, and you can get all the good information because we had a very, very detailed conversation, me and Nelson, about his puppy. Come on, listen in. If you had two littermates playing, and in play, not being mean one iota, in play, puppy A bites puppy B a little too hard, okay? What would puppy B's first response be?
Would probably to yelp.
Yeah, exactly. And that's what you're going to do.
Out.
You're going to yelp. You are going to give a scream like, ow! And most likely, your pup will back off. This is actually how they learn from a very early age, what we call bite inhibition. And that is how soft or how hard do I can or can I get away with biting before my playmate objects.
Right.
Okay? Now, if that doesn't work, and you try that a few times, and you can have to do things. You can do like what you do with kids. Give her a timeout. You put her aside.
Right.
Say, honey, you're not playing fair. I'm putting you over here. Now, if puppy A is now playing with mom and bites mom a little too hard, what's mom's reaction going to be?
Mom is going to chastise more than just yelping or
exactly.
crying.
Mom is going to give that little puppy a growl that this puppy has probably only heard before when it was a little teeny puppy with mom. And you give a good deep, and I go, ah! Like you're a kid, mimicking a lion roar. And you look him straight in the eye, you look her straight in the eye, and you give that deep, guttural growl. And you're holding her jowl, so you're forcing her to look you in the eye, and you give that deep growl and hold that freeze for a second. And what you're probably going to see is, because she can't move her head because you got her by the jowls and you're forcing her to face you, she'll turn away from you with her eyes. And that's how you know you've successfully got her. Now, when a puppy gets yelled at and they feel afraid and they feel awful because they were just reprimanded, what they want now more than anything from mom is affection.
Love?
Yeah. So after you have that uncomfortable freeze, you're staring her down, she's looking away from you, kind of wait about a minute or two, and then you can give her that, you be a good girl now, etc.
Okay.
All right?
Okay. So a lot of the things that you're saying I am doing, and it makes me feel good because these are things that I'm doing already, but I just didn't know if I'm actually going about it the right way.
Yeah, now,
I feel it is, but I just didn't know.
Now, one thing, before we get on to chewing, puppy chewing, let's finish one thing. Do not ever, even though the inclination might be there, and even though the fear might be there because you're raising a puppy pit bull, do not smack the dog, because you will end up with more problems later on from that than from the other behaviors we talked. They don't know what a smack is. Mom has never raised a paw, unless you're dealing with a boxer in play, and whacked the puppy across the face or on the head. So that's how we start sort of developing problems in dogs where we call being head shy. So that they right away they see a hand raise and they see I've seen dogs.
They want to strike out.
Oh yeah, I've seen dogs. They're in my exam room, and I have some papers on my desk on the exam table, and I pick the papers up to move them to another side so I can have more space for the dog. And I see the dog cower. So what does that tell me? That tells me that somewhere along the line, this poor dog was actually smacked with probably a rolled-up newspaper or rolled-up magazine.
Okay. And can I tell you something? I've heard from other dog owners that that's the way they chastise their dogs, by having a roll of newspaper.
Totally inappropriate. You should never, ever hit your dog. It's only going to backfire. Okay. Now, let's talk chewing. Chewing is also a normal, natural, essential behavior. So what you need to do is never say no. No is the most overused word when we're training our puppies. Because most of the behavior.
I tell you, I say that more.
I know.
I'm always like, no,
and that's the problem.
Don't do that, no.
Most of these behaviors, if you really evaluate the behavior, they're normal, natural behaviors. We just have to direct them to an appropriate object, or in the case of bathroom mistakes, to an appropriate location. But you can't say no to a dog who's got to pee, right?
Right.
You can't say no to a puppy who wants to chew. So what you do is you clap your hands, give a whistle, just divert their attention, go over to them, kind of comfortably, casually remove the inappropriate object out of their way, and immediately give them their appropriate chew toy. You put it in their mouth if you have to, and say, oh my God, you're such a good girl, and give her a pat on the head and a little kiss. And so she'll start learning, because dogs learn, as children do, from positive reward. We want that positive reinforcement, and you give them the object they're supposed to be chewing on, and they chew on it, and they get a praise, they get a pat on the head, they get a kiss, they get a little dog treat, and life is grand. And then what they're going to do is they're going to start looking more for those objects. And now that you know that she is going to behave like a puppy, you need to puppy-proof your home, and that is everything that you see that is even remotely possible that she can get a hold of that you don't want her to. Remove it or remove her. It. Okay. You got it?
Yes, sir. I got it.
All right, Nelson. Give those things a try, and then why don't you call us back in a couple of weeks and give us an update. Let us know how she's doing.
I certainly shall. Thank you so much.
You're very welcome. You take care.
All right. Have a good one.
Thanks. Bye-bye. So as you can tell, this is a normal problem that Nelson was having. I don't want people to freak out because they have those dogs, whether it's the Pit Bull or the Akita or the Doberman or the Rottweiler or the German Shepherd dog. I mean, understand these are puppies. There are certain innate behaviors that we see in our puppies. And, the vast majority of these will do just fine. It's just normal behavior. And what we need as we train our puppies, we try to teach them to behave well. It's a function of socializing them properly. It's a matter of being consistent with your messages. It's a matter of being consistent with your correction and learning how to correct properly. And that most of the things that you are just dying, that reflex of yours is to scream out, puppy, no! There are not no's. There are some no's out there, but most of the things that you're going to have to deal with on a day-to-day basis, on a regular basis, are behaviors that are essential, they're natural, they're normal. Unfortunately, because we have a crazy puppy, they're just a little bit misdirected. We need to direct them, again, to the appropriate object in the case of chewing, to how to bite properly, how to learn bite inhibition in the case of biting, learn what it's like to have a timeout and not to get you. Remember, puppies are social. They want you more than anything. So when they start exhibiting behaviors that separates, that creates a separation because you put them away, you put them back in their crate, or you put them back in their playpen, they're going to think to themselves, I don't want to do that one again. And conversely, when you praise them for the appropriate behavior, when they come over to you and they let you pet and they play and they might mouth you a little bit, but they don't ever bite down, or you happen to walk in the room and they're chewing on their appropriate chew toy, don't ignore that behavior. That behavior deserves a major praise. You run up to them, good boy, oh, you're such a good boy, and your toy, and give them a treat and give them a hug. And that's how we create this amazing bond, not only between us and our pets, but between our pets back to us. Anyway, we're about that halfway point. So we're going to take a quick break and hear from a few of our sponsors. So don't move. And if those of you listening and haven't yet had the courage to give us a call, 877-385-8882. You're here with Dr. Jeff Werber, and we'll be back in just a minute.
We'll be right back, right after these messages. Stay tuned.
Your dog digs a hole under your fence, and the next thing you know, protect your pets with Dig Defense, the amazing new product that keeps your pets in the yard. Dig Defense is safe, fast, and easy. Each unit is made from 4-gauge galvanized American steel and can be used for repairing dig-outs, filling gaps, or to hold fences down so pets can't get under them. Dig Defense provides peace of mind that your pets are contained humanely and safely. Visit digdefense.com today. DIGDEFENCE.com.
Every pet is unique. Maybe they're gray in the muzzle, yet young at heart. Maybe they're growing out of the puppy stage and into their paws and ears. Or maybe they're just trying to maintain a more girlish figure. At PetSmart, we have the right food for your pet. at a great value for you. PetSmart. Be better together.
Go to PetSmartDeal.com and save up to 30% on awesome gifts for the pets and pet people in your life. Toys, collars, leashes, PetSmart gift cards, treats, and more. Go to PetSmartDeal.com today. PetSmartDeal.com.
Welcome to Bird's Eye View on Pet Life Radio. I am Dr. Lori Hess, here with Dr. Michelle Ravish, and we are both bird and exotic animal veterinarians. We work at the Veterinary Center for Birds and Exotics and All Bird and Exotic Pet Hospital in Bedford Hills, New York. And this is a show all about birds. It's a Bird's Eye View, and we hope you'll tune in soon.
Every week on demand, only on PetLifeRadio.com.
Let's talk pets.
Let's talk pets
on Pet Life Radio.
Pet Life
PetLifeRadio.com.
So welcome back. You're here with Dr. Jeff Werber, and you are on Ask the Vets with Dr. Jeff here on Pet Life Radio. We are, I guess, one of the only, if not the only call-in show, live call-in show here on Pet Life Radio. And we want to show all our other listeners that it's great to have a call-in show. So we want you to call in. Pick up that phone, dial 877-385-8882. If you happen to be sitting at your computer, just key in Dr. Jeff at PetLifeRadio.com. If you're following us on Skype, you might even be able to, which I think you can do, but you can send us a little message. I got my Skype screen up and here on Pet Life Radio, and listen in and join in. And remember, if you get that courage up to ask a question, send me an email, send me a text, whatever it is, we will get your info and send you out a free ProSense pet product. So I'm also, as we're sitting here, we're already started August, which it's amazing how sometimes some parts of the year go so slowly and summertime goes so fast. I was actually driving to work this morning, and it's crazy, but the Los Angeles City schools actually are back at school this week. And to already see, here it is, the middle of August. Back in my day, we didn't start until usually after Labor Day, always after Labor Day, and sometimes even later in September, September 15th, September 19th. They're starting a full month ahead. I think they're going to start getting out a full month ahead. In fact, I always used to envy when I was in college. I went to University of California at Berkeley, and back then, and still is, most of the UCs are on the quarter system. Now, the quarter system, unlike semester system, when you're in semester, you have two 15-week semesters, and you could also have an option of a summer semester. But the quarter is 3 10-week quarters. So you still got the 30 weeks. What a drag. But, I mean, with the quarter system, I don't think after the first week, you're going to have a midterm or finals every single week, it seems like. And oh my God, it is so disappointing. And also because the way the vacation setups are set up, we wouldn't get out of school until like June 15th or 18th, even when I graduated vet school. And I was at University of California at Davis on the quarter system. I remember our graduation was like June 19th. How crazy. And all my friends that were going to schools on the semester system, they were getting out by Memorial Day. By the end of May, they were already out of school, done with finals, done with everything. That wasn't fair. Now, truly, they did start a little before we did, but even still. But I'm curious to know how your summers are going. I want to know if you had any problem with overheating, if you had any problem or seen anyone driving a car and leaving a dog or a pet parked in the car. We want to know about it. We want to talk about sort of still some summer issues. In many places, I know for a fact that it stays very hot through September. So just because September 21st is the beginning of, quote unquote, the autumn season, fall season, doesn't mean that we need to start easing up on some of the restrictions. And my dogs are still out there and enjoying the hot weather. And even we've had actually unseasonably cooler weather here. And we've been through a string of several days where it's been, people are going to complain, or what is he complaining about, that Werber? But they were in like the mid 80s, going up to the high 80s. But remember, here in California, at least in LA, at night, because we're close to the ocean, we get that cool ocean breeze, and it chills out a little bit. I mean, there's some people, I'm not one of them, but there are a lot of people that at night will start wearing a sweater here in LA. To me, I still like the cool breeze. But we want to hear how things have been going for you. And what we can do, and as we're getting closer, we're hitting fall. I mean, it's around the corner. I just got a call from a TV show in New York that wants me to come out in October. So we're kind of throwing some ideas around, and I realized, oh my God, October, we just finished talking about summer tips and things we can do to help our pets during the summer. And by October, we got to start thinking of holidays. We got to start thinking about Halloween and Thanksgiving and Christmas, New Year, and Hanukkah, and all these holidays were potentially problems for our pets. And what we need to do to keep our pets safe during the holidays. What we need to do to start preparing for winter, as I call winterizing your pets. So we have a lot to look forward to in the coming weeks ahead as we start talking about these things and preparing accordingly. So, but it's something that we definitely want to hear from you. One of the things that I'm hearing a lot about, and I don't know if we had a chance to talk about it on the show yet, but there have been 2 pieces on the news lately. Because, it's funny how people get such a kick out of things like this. And the subject matter is plastic surgery for pets. And, of course, when a vet who works in the Hollywood area starts talking about plastic surgery, I can hear you listeners going, oh, really? Like, come on, plastic surgery for a dog? But understand a few things. Yes, we do a lot of plastic or cosmetic surgery. But understand, I don't like to use the word cosmetic because you have that notion of, the Beverly Hills housewife who visits the plastic surgeon more than her kid's school. But we like to call it reconstructive surgery because when you're dealing with plastics, there's always a battle, especially in human medicine, between what we call form and function. Form is how you look, and function is how well you work. Right? How many times when you were think back in high school days and you saw someone that had the bandage over their nose, they clearly had a nose job, right? And what do they tell you? Everybody, hands down, they're going to say, oh, no, I had a deviated septum and I couldn't breathe, so it was just to fix the deviated septum and to take about 4 inches of hook off your nose too, but we don't count that. It was just a deviated septum, all right? Or people that get their eyelids done and they complain, well, the upper eyelid was so droopy. But we know that when it comes to humans and plastic surgery, most are doing it for form, even at the expense of function. They are willing to give up and sacrifice function so they can look differently, look better, whatever. And I'm sure if you've seen some of these people walking around in these TV shows, better is, I use that term very loosely because in my book, they look horrendous. But with animals, we're doing it purely for function. And certain problems like skin fold pyodermas, which are infections deep within skin folds, entropion or ectropion, which are eyelid problems. Ectropion, for example, in a bloodhound, where the eyelids are so droopy that the conjunctiva is completely exposed and prone to infection. Or in the case of a Chow Chow or a Shar Pei or a Rottweiler, the eyelids are actually rolling inward. We call it entropion. And the eyelids are rubbing against the eyeball, and the hair from the lids are rubbing along the eyeball, causing major pain, major infection, major irritation. We need to fix that. We see in certain dogs that we talked about earlier about the English Bulldog with their cleft palate and their split lips. We need to fix those. So there are dogs that are extremely overweight and might even have skin sagging and rubbing on the ground. We need to fix these. So our concept when it comes to doing surgery, plastic surgery for animals, is we need to repair these defects because these defects are causing problems. It's not so they're going to look better. I mean, look, let's face it. You fix a dog's eyes, and the dogs are always eyes and running and drooping and inward, and there's discharge. You fix it, then of course you're going to end up seeing a better looking dog, if you will. But that's not our motivation. And another thing that we do often is dentistry. And again, with dentistry, we are doing some orthodontic procedures where we are straightening teeth. I shouldn't say we, because usually this is done by a veterinary dentist. But implants and braces are being used in dogs, not because they're smiling for the camera, not because they have that big interview or that audition. It's because they can't chew well. They can't eat well. The teeth are getting in the way. They can't close their mouths properly. And we need to fix these dogs so they can lead a normal life. And that, again, is the reason why we take this so seriously and do so much plastic surgery. So I did a piece that's actually on YouTube, and it's called the Hollywood Pampered Pets. And you can probably YouTube it and do a search. But we did a very, very kind of tongue-in-cheek kind of thing, but it was really cute about doing plastic surgery in pets. And And again, I think we may have mentioned, I don't know if those of you or many of you had a chance to catch that article in the Hollywood Reporter. You can go to HollywoodReporter.com and just search Jeff Werber or Dr. Jeff Werber, and you can see a little bit of some piece that we did on celebrity pets, and that was pretty cool. And there's a picture, or they have me with one of my celebrity clients, Judy Greer, and it was a nice article. It was a nice article, not too obnoxious. We try not to be too obnoxious. So anyway, it's been very quiet, guys. I am really surprised that with all these opportunity for 100% free advice, not only free, but you actually get something in exchange. So you get to call in, and not only do you not have to pay, you get a gift from us here at Ask the Vets with Dr. Jeff on Pet Life Radio, a ProSense pet product. So there really is no excuse to not pick up the phone, dial 877-385-8882. Ask your questions. Don't be shy. Or you can send me, of course, a text or an email. The email is drjeff, Dr. Jeff, at petliferadio.com. And you know what we'd also like to do, and I think there's a great place, why don't you, to Dr. Jeff at petliferadio.com, why don't you send us some pictures of your pets? Would love to see what your pets look like. We can post them on the website here at Pet Life Radio, and it would be really cute so we can sort of get to know you better and get to know your pets better and see what's making you tick. I know what makes me tick because I have 11 pets at home, and they are really, really cute. And if you go to Facebook at all, you can go to Dr. Jeff Werber. You can see some of my pets because I have different pictures of my pets, and I'm actually going to be posting another shot pretty soon. I have a great shot of all 5 of my dogs, and they look amazing. It's almost like they were posing for the camera, so it's really cute. So I want you to have a chance. Why don't you send us some pictures? Just send them to me, attach them, and send them to Dr. Jeff at petliferadio.com, or you can send them to Dr. Jeff at drjeff.com. That's drjeff at drjeff.com. No periods except, of course, for the .com. So anyway, want to thank you all for joining me this very fast-moving half hour here on Pet Life Radio. Ask the Vets with Dr. Jeff. We will be back here next week. I expect to have a mailbox full of questions with your names, pictures of your pets, and a place that we can send your free product to. So until then, I want to thank ProSense, our sponsors, and we look forward to having you join us again next week here on Ask the Vets with Dr. Jeff. Signing off, I'm Dr. Jeff Werber.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.